Good evening, Kate.
Hello.
So, thank you for your very nice speech today about vaccinations and the homeopathic treatment here in Badenweiler. So, my first question is that please explain me in details why vaccination is harmful and what happens exactly during a vaccination.
Okay. So I just want to start to say that in this discussion we're not arguing or we're not debating whether we need to prevent infectious contagious disease. We're more just looking at the current methodology of vaccination and what the flaws are in the methodology, and if there is a better option, how might that work? Yeah. So, as I was saying during the presentation, that there's sort of two main problems with vaccination. One is the method of injecting the disease material straight into the blood, and the other is of doing that in immune systems that aren't mature enough to be able to process this injected material. Well, and there's a third, and that is that there are so many diseases injected in such a short amount of time that there is not the time necessary to reconcile it. So, for instance, if we were to be exposed to a natural disease, it would be just one disease, and each disease has their own period of prodrome and incubation and symptom and convalescence. And one disease, maybe the whole time is 3 weeks. This is without any homeopathic treatment, if it's just left on its own. Some may be shorter, some longer, depending. So it means that it's necessary for the immune system to work that much time in order to clear the disease. Okay, so with vaccination, also, normal exposure to disease, we contact the disease through mucous membranes in the mouth, in the lungs or digestive tract, or if it's a cut, through the skin locally. And this initial contact upon exposure to natural disease signals the deeper aspects of the immune system to alert. It says, there's an intruder coming, pay attention. And this peripheral aspect of the immune system begins to develop signals of development of fever, development of localization, inflammation, something to isolate the pathogen in a small area if possible. And if the pathogen gets into the bloodstream, then the deeper aspects of the immune system that trigger specific antibody response become awoken, and then antibodies are created to disarm the pathogen. But then with the use of the general immune system, a discharge is created to remove it from the body. So this is with natural exposure. So the first problem with vaccination is the disease is injected straight into the bloodstream. And so the peripheral immune system is not alerted. There's no localization, there's no fever developed, and there's also no attempt to remove it. So then you have these floating viral particles in the body that maybe eventually the immune system will start to recognize and develop some kind of response to clear. So that's the initial first problem with vaccination, is the injecting. But then you compound that with putting vaccination into infants' immune systems, where the immune system takes ordinarily from 5 to 12 years to fully develop. And even in the first 1 to 2 years of the infant's life, there isn't the ability to make antibodies. It's upon exposure to the natural environment slowly the immune system begins to develop antibodies. So if you vaccinate an adult or a child over like school-age child, their immune system is already developed, and even though you're bypassing the peripheral immune system, there's a chance then the immune system is able to reconcile and produce antibodies. But with infants, that doesn't happen, and so the disease material just stays in the body and creates confusion in the immune system, and then at some point the immune system starts thinking, oh, there's something wrong, and starts producing allergic responses or fevers that come and go, or some kind of discharge, chronic discharge, but because the proper antigen-antibody complex isn't formed, then they're not effective discharges. The most common symptom is ear infections or ear inflammation. Now some pus has been generated, white blood cells, we've localized the pathogens, and maybe we're trying to get them out. The problem then is the doctor would give antibiotics, which does not help the body try to rid of the problem. It actually takes the fever away and quells the symptoms, and then after the antibiotics wear off, maybe 2 weeks later, the child has another ear infection, maybe another fever comes, and more antibiotics are given, and it just drives the problem deeper and deeper in, and not allowing for the opportunity to release.
So it gets a vicious circle.
Yeah.
Kind of. So let me repeat. Do you think, or the increasing of allergies,
yes,
the abuse of antibiotics,
yes,
and the vaccinations,
yes,
all together,
it's the
influence
same story.
Each other? You get in this vicious circle. So you think that the increasing of allergies, one motive is that they abuse antibiotics and they vaccinate.
So,
and I wanted to point out that if the needle is touching goes inside, is touching the skin, so a kind of foreign protein reaction is happening. Can you tell me chemically what happens in the body?
So you're saying if it's injected,
Yeah.
or just a skin?
No, if it's
injected.
Yeah.
So I don't know exactly, because I'm not necessarily immunologist like that. But initially, nothing happens because the body doesn't recognize that there's something inside.
Yeah.
And then, because it's in the bloodstream, at some point the white blood cells say, oh, there's something foreign in here, we need to get rid of this. And so it can stimulate antibody production. There's two aspects of the white blood cell. One is the T1 response, and the other is a T2 response. And upon normal exposure, these killer T cells work in unison. The T1 is destroying the damaged cells that maybe have viral particle or bacteria. They're destroying them and passing them to either discharge through the nose or the intestine, something. And then the T2 is the production of antibodies. But both of these, and particularly the first one, they require the humoral aspect of the immune system to be activated. So if it's which starts with not the external exposure. So for instance, I think that the live polio with the sugar cube that they used to have, is actually works with the immune system, because the first contact is through the throat and the mucous membranes. And so if the disease gets into the blood, then the immune system is able to make a proper reaction. But if you have this heightened T2 response, they've actually begun to see that this artificial elevation of antibodies also produces a allergic type symptoms, heightened histamine response and things like that. So all the allergies that we're seeing and the asthma and the skin conditions and the food sensitivities and even some hyperactivities are because of this elevated T2 response.
Yeah.
Yeah. So there was one other point that I was...
And even epileptic and neurological problems, I guess.
I'll get to that bit.
Mm-hmm.
That is because of the nature of the diseases in the vaccines. Okay, but before we get to that, there was the last point, which was one injecting, two you're injecting into an infant's immune system. But the last point, there's multiple disease agents injected at the same time in very quick succession.
Mm-hmm.
So what I started with is it takes several weeks for the body to work through one disease.
Yeah.
But if you're injecting 7 diseases at a time, and then 2 months later, 7 more,
again,
there isn't the sufficient time, and so the immune system is in process of one or other of the disease, because it also prioritizes and says, I'll do this first, and then I'll do this first. And each disease has their cycle of action. So the neurological problems, the DPT vaccine, diphtheria, pertussis, and tetanus, the vaccine is actually created from the neurotoxins. Those diseases that aren't able to be resolved because there's so many coming, they rest in their organ of affinity. Okay, so they will gravitate towards the nervous system. The MMR, which is also a particularly bad shot, because the measles and rubella are exanthematic diseases, which need to come to the surface of the skin in order to be removed from the body. That's the only way those diseases can be cleared, is through a pustulation or rash of sorts, But because the method and the so many vaccines and immature immune system, it's not able to clear. Well, suppressed exanthematic diseases also go to the nervous system. And you see the symptoms of the disease in the nervous system, the brain cry of apis from suppressed eruptions and other remedies, stramonium with all the fears and the night terrors and everything. Each cuprum also has zinc too, the stupefaction and the dullness. Need to repeat, their mind, their cerebrum is just suppressed. So those are some of the symptoms that you see.
So the multiple vaccinations are more harmful than a single
shot.
Yeah.
And that I lecture a lot in Minnesota, where I'm from, and knowing also that each person needs to make the choice that they feel comfortable with. And for some people, all vaccines, or saying no to all vaccines, is don't feel comfortable with that. Because also, if you make the choice to not vaccinate, because infectious contagious disease is real, what do you do instead? So if you have already a homeopath or a kind of system of medicine that you know can help if infectious disease comes along, then you're more able to freely make the choice, I feel confident to not vaccinate, right? And so there are people in the middle that want some vaccinations maybe, or if they're going traveling. And I recommend in that situation to slow down the vaccine schedule. You don't have to follow, I don't know what the laws are here, but in Minnesota you don't have to follow the schedule, and you can ask for one vaccine at a time. You wait until the child is a year old. You look at the risk of the disease. Okay? The risk factors of the disease. So like mumps is typically a relatively mild illness. There's a risk factor during puberty that may cause sterility. But then we know there's many remedies that can treat mumps too.
And you said today how important it is to go through these.
Some diseases are an evolutionary process in the body. So
yes, and it's very healthy to produce a fever and to go through these children illnesses because it strengthens up their immune system and the personality of the child. It's part of the growing process.
Yeah, exactly.
And even developing fever and
it's necessary. So you look at the risk of the disease, the risk factors, and disease incidence too. Risk factors also, like, I don't know if here, but newborns are injected straight away with hepatitis B, and it's illogical because it's a sexually transmitted disease or blood transfusion disease, and also the vaccine only lasts for 4 years. So if they were, by the time they're sexually active or teenagers' tendency towards drugs, then the vaccine is now worn off. But because the B relates with liver functioning, for sure the virus is going to go into the liver and cause problems in that way because of the immune system.
Even tetanus doesn't make sense because a newborn child doesn't,
get a puncture wound except for the needles of the vitamin K shot.
Yeah.
But so then, and also incidence. So if there's no incidence of disease, then is it necessary to take the vaccine?